Hello, welcome back to Informs What's Your Story. I'm Kara Tucker, editor of ORMS Today. Today I'm joined by Louis Luangkesorn. He is the lead data scientist at Highmark Health. We will talk about his career path and some career advice and some other things today. I'll make sure to please give the video a thumbs up and like and subscribe. So, Louis, thank you for joining me. We're going to start, before we dive in, just a quick fun fact about you, or if you have any hidden talents you want to share.
So I think my fun thing is my basement at home is set up as a CrossFit gym.
Cool.
And so, yes, I have a full set of weights. I have dumbbells, kettlebells. I have several pieces of cardio equipment. I have mats on the floor. Yeah.
So you do CrossFit?
Yeah.
How do you know what do they call them?
The workout
of the WOD. How do you know what to do if you don't have someone to tell you? You should look it up.
No, so I follow a home-based programming called Street Parking, and yeah, it's for people who are anywhere in the world. They understand there's a wide range of equipment that people have. It turns out that their probably biggest two demographics are stay-at-home parents and deployed military, because of the fact that they have tight time schedules and a wide range of equipment available to them and resources, and they'll give the street parking people give options on things you can do and modifications for the things I can't do.
Those box jumps look difficult.
Yeah,
that's very cool. I didn't know you could do an at-home one. I had looked into that at one point, but it's too far, too expensive,
Yes, the at-home actually works out very nicely. Yeah. And their tagline is, if you have a pair of dumbbells, we can make it work.
Nice. Awesome. Well, thanks for sharing that. We'll get into your Informs and career life now. So first start with how long you've been an Informs member.
Let's see. So I probably maybe 97, 98.
Oh, wow.
So we're looking at 27, 28 years. Yeah.
So pretty much right after Informs was born, you joined us, right? We were 1995 was the merger.
That's right. I think my first contact with Informs, I remember taking an operations research class as an undergraduate, and I had to read a journal article, and that was related to, and I picked one that was related to emergency management. I was a EMT when I was in college.
Okay.
And so I picked something that I knew. But yeah, that was my first, when I first got introduced, it was still the Operations Research Society.
Okay, awesome. Okay. We're glad to have you for this long. So tell us how you first became interested in this field and what your main career expertise is.
Okay, so I had a little bit of exposure as an undergraduate, but after college, I had jobs as a policy analyst for water resources, Corps of Engineers, and then I worked as a logistics analyst.
Okay.
And so I learned there that to start seeing things as systems, that it wasn't just the individual technical details that mattered, it's how everything fit together. The equipment, where it was located, the maintenance, the people involved, all that comes together. Also with my job, my first two jobs, I was working with people that they were really changing the way that their professions did business. So it's all incredibly new. And I also decided then that I wanted to do very new things. I didn't want to do didn't want to do things that just repeat what everybody knows. I wanted to change the way we worked.
Yeah.
And that's actually how I got to end up going back to grad school and also this particular field.
Okay.
Right?
What did you get your graduate degree in?
So I got my graduate degree from Northwestern. The department name was Industrial Engineering and Management Science.
Okay.
But it was really an operations research degree.
Okay. At least it had the management science in there too.
Right.
It seems as though you've hopped back and forth between industry and academia for your career, correct?
Yeah.
So give us some pros and cons of each, and then why you ultimately landed in more industry roles, it seems like.
Okay. My purpose for going back to grad school, it wasn't math per se. Math just happened to be my vehicle. It was the idea I was going to be doing new things. And I think in the industries I was in, so I was at the RAND Corporation first. So that's a think tank, and it's very actually researchy oriented. We're working on things, again, the world is changing on us, and we're doing our analysis because we're trying to help our clients figure out how do we change with the world, And so the things that we're working on, you can't fit prior solutions in it. In fact, we were taking the old solutions and reworking them for the changing situations. And I think the same thing is where I'm Highmark. We have a tagline that says we're trying to reinvent health. And we have a view that the current healthcare system is broken, and we're trying to make it, fix it. And so this means, well, one side effect is we have to try models of how we work and how we deal with our customers, our clients, how we work with our provider partners. And yeah, we'll eventually need new models. And so on the industry side or the practice side, our models the math isn't new, but we're modeling things for a particular geography, a particular set of clients, and a particular strategy. And that's where the research and innovation comes in.
Okay.
And then as opposed to, so when I went to academia, which was after Rand, I was somewhat recruited by a senior professor, Andrew Chafer, who was at Pitt at the time.
Okay.
And he had just gotten this very large contract along with some other professors at the VA hospitals.
Okay.
And his comment when he was bringing me on is that he was looking for somebody who was like a professor in the sense that I can follow the math, I can do math, I can be innovative. So I have the PhD in math, in operations research, but I could take that and implement it so that a client could use it, which was the VA.
Yeah.
And so my whole time at Pitt was actually industry focused.
Okay.
I was working with the VA hospitals, the Children's Hospital of Pittsburgh. I did capstones for the industrial engineering and the health science engineering. So I'm working with small, medium manufacturers and businesses across Southwest Pennsylvania, healthcare systems. We have all these engineering and math skills and practices, and we're trying to fit them into very particular environments. And so the innovation in practice comes to be the environment you're going into, and not inventing new math.
Right.
Yeah, which is what the academic.
Right. So I feel like there's a little bit of a theme though. If you were an EMT during college and then the VA hospital and all the healthcare stuff, you feel like that's always kind of been there in the back, like just healthcare was kind of like this theme, right?
Yeah. So when I was at Rand, I did a lot of logistics and resource management with the military. And on the side, I was doing work with the CDC.
Okay.
And so one of the things that was attractive for going to Pitt is I reversed that next. I was primarily healthcare, and I was doing a little bit of disaster emergency response modeling. So one thing that helps me, again, working in healthcare, well, the hospitals when I was at Pitt, and also my Highmark Health has a healthcare system inside of it. Being an EMT means I have the subject expertise to talk to clinicians.
Yeah.
Because I know their world. We know how you think, how you process information. Those kind of patterns are things that I know and I'm kind of conversant with. It makes the speaking, like especially speaking nurses, it makes it for a very fluid conversation.
Yeah. Do you still do EMT stuff on the side? Are you a volunteer EMT or anything?
No. Although I volunteer with the American Red Cross.
Okay.
And so I remember one of the things that I do with them is, well, I'm a planner, which is very much the operations research side of things. I create models, and then I also work on creating instructions on how to use them and a workflow to go with our decision-making process for the Red Cross disaster response.
Okay.
Locally, I also do things like the normal thing is a disaster action team, which is I go to house fires. And I would work with the family. So the fire department takes care of the fire.
Okay.
And we take care of
running into
we take care of the family, making sure they have food, clothing, shelter.
Okay.
And we support them while they kind of figure out what's their next steps.
Wow.
It's funny. There's at the hotel we're at this conference. There's a firefighter training conference. And one of the departments is actually in my area.
Oh.
We have this joke with them is that we always see these firefighters at 2:00 in the morning at a fire. We're not used to seeing them in daylight and under like good lighting conditions and like, dressed and
not in uniform.
Right.
It's like seeing an athlete outside of their uniform.
Yeah. But a professor in nursing, I was talking with her and she explained that we had the conversation again. It's a really fluid conversation because we so much. And then she was asking me about my Red Cross role, and her comment was that I, like nurses, learn to talk to people in the moment because we meet people, they're having a bad day.
Right, and you don't know what you're walking into.
We don't know what you're walking into. There's nobody in front of us, so we are the first person that they meet and have a really good conversation with. And so me and from the Red Cross person and then the nurses, they have that same thing where they're assessing what kind of person they're talking to, what their frame of mind is.
Yeah.
And her comment was, I talked to a nurse, we're both doing that. And it makes that whole conversation really fluid. And me working professionally inside a healthcare system.
Yeah.
There's a big synergy.
Yeah, that's great. Yeah. So do you have any advice for current analytics or data science students that are trying to decide their career path right now?
So the data science, again, what makes the data science a science is the fact that it interacts with the real world. And so I did this when I was a professor as well. I always tell students, find a customer. So universities in our classes, we can teach you programming, we can teach you math, but it's that interaction with someone who cares that is very different, and you can't really teach it. I remember I had one course in data analytics. I told my students that I have all these requirements and trying to simulate a client. If a student actually had a real client, meaning somebody who actually cared about their project, they should see me because I was willing to just throw all that out, and I will come up with a way with making it work so they can actually serve somebody in the community.
Yeah.
Because that would be more valuable than my simulated clients.
Right.
Get a chance to work on a data problem with a real person, and I always recommended like nonprofits or some group that you already know.
Right.
And have a client where you have that interchange of that back and forth between here's data, here's discovery, here's a problem, and as you go through this discovery and the data of what the real situation is, the problem changes. So experience that.
Yeah.
And that's how you actually know this is where you want to be, because that's what the career is.
Maybe they could help with our pro bono analytics, right? We're always looking for volunteers and people to help the nonprofits.
Yeah, I've done 2 projects with them.
You have? That's great.
Yeah, I did one project with Houston Methodist Hospital.
Okay, yeah.
And my partner and I, we got an award from them.
Yes, I knew that. I feel like we did maybe a news item about that in the magazines.
Yeah, and I did a project with Baltimore City Fire Department.
Oh, wow.
Yeah, staying in the realm of fire.
Look at you. My goodness. So you work in people analytics. You kind of touched on this a little bit with, have the customer facing stuff and working with clients, but can you just briefly explain that and what you think the number one thing that is needed to build strong relationships between the analyst and the business partner?
Okay, so I'm an insurance company, and so most of the data scientists are looking at how do we serve our members. So people analytics, if that's outward facing, people analytics inward facing, we look at the employees.
Oh, okay.
And especially how do we retain employees? So because when you lose an employee, the usual factor is you basically lose their annual salary in cost because of having to replace them.
Right.
So we have a lot of projects that work on retention. Why do people leave? And can we make changes so that they will more likely to stay? We also have some projects on shaping the workforce. So we need a certain mix of people, of skills, of experiences, and how do we make it so that we're at the right level of skills, experiences, so we can do our jobs in whatever area.
Okay. And what's the number one thing you think between building strong relationships here?
So the big thing is actually learning how your business partners make decisions. So analytics, the business doesn't exist for analytics. The business exists for something else. So in our case, we're trying to provide health for our members, whether it's going into the hospital or other things that we can provide for them.
Right.
In the human resources cases, how do you work with the employees and improve the employee experience so people want to stay?
Okay.
They have a purpose, and in their because they're professionals, they have reasons that make decisions. They have criteria they use to make decisions. So you need to find out what they are. It's what's tricky sometimes is a lot of people don't actually know how they make decisions because it comes intuitive.
Yeah.
So you end up having this build relationship, and you have conversation with them. Okay, you did this. Why? How do you do this? How did this initiative work out? And you build up all in the analyst the tacit knowledge that the decision maker has. And then, you're not going to become the decision maker, but you're able to support the decision maker better as you learn all this, this tacit knowledge and deep knowledge that they use and they bring with them and when they make their decision.
Okay, thank you.
Yeah.
Well, you mentioned already how you discovered Informs, so we can breeze past that one. But you have also been here long enough and have volunteered enough that you are a senior member of Informs, which is new the last year or so. What does having that title mean to you?
I think it means that I've seen changes. So we've seen the world, our industry around us has had changes and new techniques and new categories of things that come. So for example, the latest thing is generative AI. And so my company, I was one of the people, we had the task of trying to use generative AI on a wide range of projects and finding out when is it good, when's it useful, when does it not work, how do we break it, and then how do you make it work better for us and to teach the rest of the company. And so having this very a broad background. So academics talk about how academics have very narrow backgrounds, but a practitioner over time has a very broad background. And so for us, I think generative AI, it's something that we could put into our wider map of the world. It has a place in our map of the world. And for me, I already had ideas of knowing how Gen AI is created and knowing what it can do. I already know what I'm looking for in terms of like, how do I make it fail? And I can start doing that exploration of how do I make it work better? And also what are the things I have to avoid? But it's being able to put all these changes of the world in context and being able to, teach other people about it.
Okay, great. Thank you. So we're going to go back in time a little bit. Tell us what you were like in college and if you would do anything differently.
So that's a funny question. So right before this conference, there was something called the Program Directors Conference.
Okay.
My undergraduate college roommate was here for that.
Really?
He became a professor of statistics at University of South Carolina, and he just got approval to create a program.
Oh, awesome.
And so we haven't seen each other. But you missed your opportunity because he's not here anymore to ask.
Oh, bummer. Well, so whatever you say, we'll take as the truth.
So unlike him, I was one of those people who had no idea what I was going to do with it when I grew up, when I started college.
Yep.
And so I was using college as my way of finding about the world. And actually, that's how I became an EMT. Becoming an EMT was my way of finding out about what the world was like. And I think, yes, I was doing all the engineering classes. I also double major in political science, again, me learning about the world. But how things worked at a very basic, on-the-ground level. Here's my technical skills, but I'm doing it at street level, and I'm doing that in an environment that includes the hospital systems. I moved on through university. It's become upperclassmen. You become leadership positions, and learning how systems work and how to work on manage operations. And so I'm not going to say that when I finished college I knew what I was going to do when I grew up. But I think I did use that time to like learn about what the world was like.
It's like
and I can go from there.
Good way to do that. I was similar. I had no idea for most of my college career.
And I know, like, I remember when I was a professor, I was thinking like all my students were much more career and professional goal oriented than I was then. Again, recognizing that I really didn't know what I was doing. Using that time to learn about the world was probably the right thing to do.
And like you said, you're still taking your classes. It's not like you were slacking there. I have one final question for you. If this interview were to end and you would walk outside and find a winning lottery ticket for $10 million, what would you do?
Okay. So I'd have to notice that there's a ticket. So we'll make that assumption. I actually noticed it was there.
It's huge. It's on the floor. You can't miss it.
Okay. So again, I volunteer for the Red Cross in a number of roles, both national and local. There is a long tradition of people like um, effectively volunteering full time. We joke that their poor spouses didn't realize what they were getting into, and then and their retirement turns into doing Red Cross work all the time. And I already told my wife that that's what she's in for.
Oh, no.
But that's what's going to happen. I'll probably, I'll be doing it. I mean, there'll be that was probably what my life would be after if I left the workforce and retired. I would be
volunteer.
and I would be going to disasters all the time.
Okay. Sounds great. Well, Louis, thank you so much for being here today. Thank you so much for watching. If you haven't yet, please like and subscribe to our Informs YouTube channel and come back for more awesome content anytime.